Imagine a biological wire so incredibly crucial to our daily survival, our craftsmanship, and really just how we interact with the world that anatomists actually dubbed it the laborer's nerve. Or, if you want to be a bit more poetic about it, the eye of the hand. It's literally the primary conduit for the complex movements and sensory feedback that make human hands so amazingly capable.
Welcome back to The Explainer. Today, we're taking an anatomical road trip. We are going to trace the fascinating journey of the median nerve, starting way up high in the shoulder and traveling all the way down to the very tips of your fingers. It is a journey packed with tight squeezes, crucial supply drops, and some pretty profound clinical implications.
Here's our roadmap for this trip. We'll be covering roots in the upper arm, forearm flexors and mnemonics, the carpal tunnel squeeze, powering the human hand, and finally, clinical lesions and deformities.
Okay, let's dive right into Section 1, Roots and the Upper Arm.
So, every major nerve in the upper limb originates from a network called the brachial plexus. But what's truly interesting here is exactly how the median nerve is formed. Unlike some nerves that just spin off from one single cord, the median nerve, it's a true collaboration. Branches from both the lateral and medial cords of the brachial plexus merge together right in the axilla, the armpit region. This means it gathers nerve roots all the way from cervical spine level C5 down to thoracic level T1. That is a massive bundle of instructions it's carrying.
Looking at the overarching highway our nerve travels, it heads from its formation in the axilla straight down the arm. But here's the funny thing. In the upper arm, the median nerve doesn't actually do much. It drops off no major branches. It's basically just a passenger riding in the passenger seat, making straight shot down toward the elbow, getting ready for its real work, which kicks in a bit lower down.
Now, the first major landmark on our road trip is the cubital fossa. That's that triangular depression right on the inside of your elbow. As the median nerve travels down the arm, it initially runs lateral to the brachial artery, but about halfway down, it boldly crosses right in front of that artery. By the time it enters the tight bottleneck of the cubital fossa, the median nerve is sitting as the absolute most medial structure in that space.
Moving right along to Section 2, Forearm Flexors and Mnemonics.
Let's be real, anatomy is packed with complex names, so memory tricks are absolutely essential. Our source material provides a highly memorable and, honestly, kind of quirky mnemonic to lock in the superficial flexor muscles of the forearm that the median nerve supplies right out of the gate. It goes like this: feel climate in Rajasthan, days in Singapore in PLS.
Let's math that out, shall we? Feel climate reminds us of the flexor carpi radialis. Days in Singapore stands for the flexor digitorum superficialis, and PLs is for the palmaris longus. The median nerve branches out to supply these three superficial muscles while it's still hanging out in the cubital fossa. Oh, and a quick side note, it also supplies the pronator teres just before it dives deeper into the forearm. As the median nerve plunges deeper into the center of the forearm, and by the way, that's exactly why it's called the median nerve, it runs smack down the middle, it gives off a critical branch called the anterior interosseous nerve. This specific branch takes care of the deep sea diving, if you will. It innervates the deep muscles, the pronator quadratus, the flexor pollicis longus, and the lateral half of the flexor digitorum profundus. Which brings us to Section 3, the carpal tunnel squeeze.
Welcome to the carpal tunnel. Here, the nerve is forced to squeeze through a really tight space at the wrist, roofed by a tough band of tissue called the flexor retinaculum. If the pressure inside this tunnel goes up, the median nerve gets compressed, leading to carpal tunnel syndrome. You've probably heard of it. It's the most common nerve entrapment condition out there. Patients usually experience numbness and tingling in their fingers. But here is a fascinating little detail. The skin over the fleshy base of the thumb, the thenar eminence, is usually completely spared. Why? Because the sensory nerve branch for that specific patch of skin actually branches off before the nerve even enters the tunnel. Talk about an anatomical escape hatch.
So how do clinicians test for this entrapment? There are two main ways. Step 1 is Tinel's sign. This is where the clinician simply taps directly over the median nerve at the wrist. A tingling sensation, like a little electrical shock, means a positive test. Step 2 is Phelan's maneuver. For this one, the patient holds their wrists bent inwards in forced flexion for about 60 seconds. If doing that reproduces the numbness and pain, it's a massive red flag that the nerve is down there crying out for space. All right, let's get into Section 4, Powering the Human Hand. Once it finally makes it into the palm, the median nerve gives off this recurrent branch that actually curves back around to supply the muscles at the base of the thumb. Our sources offer another incredibly fun, totally out there mnemonic to memorize these muscles. Ready?
Oye papa, antipolisbula legi, per partiband.
Let's follow that funny mnemonic directly over to the anatomy. OP stands for opponens pollicis. APB gives us abductor pollicis brevis, and FPB is the flexor pollicis brevis. These three muscles make up the thenar eminence, and let me tell you, they are entirely responsible for the intricate, precise movements of your thumb. We're talking especially about opposition, that vital ability to touch your thumb to your other fingers. Without these muscles, human dexterity as we know it simply wouldn't exist. We'd have a really hard time using tools, texting, you name it.
But motor control is really only half the story. The median nerve also provides sensation to the palm and the palmar surface of the lateral 3.5 digits. To be specific, that's the thumb, the index finger, the middle finger, and half of the ring finger. And this right here is exactly why it earned the nickname the eye of the hand. It's feeding the brain the ultra-precise tactile information we need for fine motor control and for feeling the world around us.
And that leads us to our final stop, Section 5, Clinical Lesions and Deformities. When diagnosing a nerve injury, clinicians basically have to become anatomical detectives. The symptoms a patient presents with differ starkly, and I mean completely night and day, depending on whether the roadblock occurred high up near the elbow or lower down at the wrist. Let's look at a high-damage scenario first. Imagine a supracondylar fracture of the humerus at the elbow. This can sever or completely crush the median nerve way before it even gets a chance to supply the forearm. The result? The forearm flexors are completely paralyzed. This means the arm stays constantly supinated, with the palm facing upwards, and wrist flexion becomes incredibly weak. Most famously, though, if you ask the patient to simply make a fist, they can only flex their ring and pinky fingers. The index and middle fingers stay pointing straight up. It's a very striking, iconic clinical sign known universally as the hand of benediction. Now, contrast this with damage down at the wrist, perhaps from a deep laceration like a bad cut. In this case, the forearm muscles are perfectly fine. They got their nerve supply higher up, so you don't get that hand of benediction. However, that crucial recurrent branch to the thumb, that gets destroyed. The thenar muscles waste away, which causes the thumb to just fall flat back in line with the rest of the fingers. The patient entirely loses the ability to oppose their thumb. Because the hand visibly flattens out like this, clinicians refer to it as an ape thumb deformity.
Which brings us to a final, thought-provoking question for you to ponder. If the median nerve is truly the eye of the hand, what actually happens when you turn off the lights? Without it, we don't just lose movement. We lose our primary sensory connection to the objects we touch, the things we build, and the people we hold. Grasping the anatomy of this remarkable biological wire really gives us a profound appreciation for the everyday, absolute miracle of human touch. Thanks for joining me on this anatomical road trip.